Oregon Health and Science University is a 530-bed academic medical center. In fact, it's the only academic medical center in the state of Oregon. We've got a new Center for Health and Healing that was built down on the south waterfront in Portland that's connected by an aerial tram from the main facility down to that building. The Center for Health and Healing is the first LEED Platinum certified healthcare facility in the world, so we're very proud of that fact. OHSU really started considering RTLS when we started the planning for a brand new facility adjacent to our current hospital. The new tower was a very radically different design from the old hospital. Very, very long nursing units, a large bend really in the middle of the unit. So nurses really had limited line of sight from one end of the unit to the other to be able to either find things, find other staff members, and it was critical that we had a means on a unit that large for the nurses to be able to quickly locate the equipment and technology they needed to care for their patients. We did a combination survey of both surveying staff and direct observation of how our clinicians were looking for equipment. We came up with a figure of we were spending about $1,700 per shift across our entire facility looking for equipment. That's not just nurses' time, but it's other staff time that's involved as well. $1,700 per shift and 2 shifts per day, annualized, it comes out to over $1.2 million we were expected to be spending on just looking for equipment around our facility. We started out with about 1,200 active tags and tracking equipment. As we started evolving the system to track temperature and track other devices, that quickly jumped up to about 2,500 tags. And as we get more and more requests and demands from our customers, not only to track the high dollar value critical equipment, but to even track some of the more mundane equipment like a patient walker or a cane that's needed to be able to help care for a patient. We're up to about 4,000 tags now active on our system. A device doesn't necessarily have to be a high dollar value item to be tagged. It simply needs to be necessary for patient care. We work closely with our patient transportation manager. He often comes up and really tells us and gives us good stories about how his staff use the system. He continually says when they need to find a critical item like a bariatric wheelchair for a patient, they can look it up in the mobile view system and walk directly to it. In our emergency department, which is a very busy level 1 trauma center, oftentimes patients would come in and go up to the operating room or an ICU on the trauma stretcher. Those stretchers wouldn't necessarily always find their way back to the ED. So in order to continue to be prepared for the next patient coming in, they can quickly find the device in mobile view, go up and retrieve it, and get it back to the ED so it's ready for the next patient. It's been an absolutely great partnership working with AeroScout. We really truly believe that if you can dream up an idea of a way to use the system, AeroScout can really help you and develop the means by which to accomplish that.